I'm Charlie, and this is Dr. Lauren Bailey, and you are a genetic counselor, right?
Correct.
Okay. So I'm going to go ahead and list my goals for the Zoom. So I have 10 goals, and I'm just going to go in order. So my first one is to see what kind of education is required for your job field, and to see what major you graduated with, and to apply what your major was to excel my chances of getting into graduate school, to see how long graduate school takes for this profession, to see what to expect in clinical training, what kind of research opportunities there are for this job, to see what genetic testing is commonly used for, to understand how pharmaceutical companies can use this information from a genetic counselor to help treat a patient, and to see what type of rare diseases they treat the most, and to see what are the day-to-day responsibilities for a genetic counselor. So I'm going to go ahead and start off. So where did you go to college, and what was your major?
I went to the University of Georgia, and I graduated there with Bachelor of Science degrees in biology and psychology.
Ooh, I'm thinking about going into microbiology and public health.
Nice.
So it's very. What made you interested in your field of work?
So I always had liked genetics, but I think that I originally thought that I had to work in a lab to do genetics, and I wasn't super interested in working in a lab. And then my junior year of college, I took my genetics course, and I actually learned about medical genetics and genetic counseling in that class.
Fun. What graduate school did you attend?
The University of Alabama at Birmingham.
Explain what kind of clinical training you went through.
So graduate school for genetic counseling is a 2-year program, and your first year, it's all coursework. So learning about medical genetics, different medical or just different genetic conditions, genetic testing, those kinds of things. And then the summer between my 2 years, I started my clinical rotations, and my second year of grad school was primarily clinical rotations. So essentially working as a genetic counselor, with basically our research projects were really our only class the second year. So mostly coursework the first year, and then the second year is all clinic.
Can you tell me about the research requirements in genetic counseling programs?
Yeah, so most genetic counseling programs require every student to do some form of research project. That can be something like interacting with a specific population, say, talking with women who've been diagnosed with breast cancer and have gone through the process of genetic testing for that, and what their experiences were like, whether they found genetic counseling helpful. Mine was focused on biochemical genetics, and I basically developed a tool for education of residents and folks who might be in an ER type setting, who might come in contact with patients with biochemical conditions who are having acute biochemical crises, but who may not have ever had any exposure, and so they needed to learn more about what those look like. So if they do come in contact with them in the ER, they would be better equipped to actually diagnose the patients and treat them appropriately. So it can kind of run the gamut.
Okay. Can you explain your role as a genetic counselor at Duke?
Yeah, so I joined Duke straight out of grad school, and my role there was both clinical and research. So I saw patients in clinic and managed their referrals and all their appointments. I also participated in some research studies where I was doing visits, but perhaps those visits were kind of outside the typical realm of what they were getting for their medical care. So trying to answer some new questions. So I would be involved in the application process for institutional review board. So that's where you start up a new study, and you have to get basically permission from a review committee that the study is, appropriately structured and that it's ethical and all those things. So I would write those types of protocols and the consent forms that you have patients sign if they want to participate. And then I would be involved in the actual visits for those studies. So that might involve coming in and getting lab tests or, you know, imaging, maybe an MRI that was kind of outside of what you might do in regular medical care, but would answer some questions that we didn't quite have the answers to yet, based on what we knew just seeing the patients in clinic.
Okay. What were your day-to-day clinical and research responsibilities?
So I was usually in clinic maybe one day a week, and that's when the patients would actually come in, and I'd get medical history. I would, you know, review any new symptoms that they had, would review that with the geneticist. And then we would, based on that, make recommendations for what they needed to do, any changes to any treatment plans. But when I wasn't in clinic, I was primarily doing documentation, so writing notes. I would maybe be in meetings to talk about, you know, are there new publications for some of these conditions that maybe we need to change what we're doing, or is there a new technique or technology that we need to see if we can kind of integrate to what we were doing. I would field calls from patients. If perhaps a patient of ours got admitted, I might go and see them on the inpatient side while they were in the hospital. I also helped a lot with other physicians who might encounter patients, or say we had a patient with a condition who needed to see a pulmonologist, so a lung doctor. I might kind of do some education and talk with them so that they understood kind of what we were looking for and what we needed from that visit.
Okay. Can you explain the meaning of a rare disease?
Yeah, so there's actually, I think, a definition by the FDA that a rare disease, I believe, you may want to double check the definition, but my recollection is that it's a condition that affects less than 200,000 people in the United States. So a lot of genetic conditions fall into that realm. And the reason that I think it's important to recognize what a rare disease is because unlike more common conditions like heart disease or diabetes, a lot of times rare diseases, because of the small numbers of patients affected, don't always get the same attention with regards to education, research dollars, all those kinds of things.
Yeah. How is genetic testing done?
So genetic testing primarily is done on a blood sample. There are some tests that you can do on like a biopsy. So, you know, if it were a GI condition, perhaps maybe a polyp, a biopsy, say from like a person who you might be being screened for breast cancer, but primarily genetic testing is done on blood. And what they do is they're able to take that sample and extract the DNA that is in that blood sample. And then they're able to use some different types of technologies depending on the test to actually look at the DNA from that sample and see if there are any alterations or changes that would lead to someone having a genetic condition.
How do you use genetic testing to identify rare diseases?
So it's basically, I'm trying to think of the easiest way to kind of explain. There's a technology called PCR, or polymerase chain reaction. And essentially what PCR does is once that DNA is extracted from whatever sample type you use, blood, muscle, anything, it amplifies it. So it basically is almost like a giant copy machine, because oftentimes if you're getting DNA from a tube of blood, and say you wanted to run multiple tests, you might need more DNA than what's just in that sample. So PCR is a lab technique where you can basically make a lot of copies of the DNA, and then that allows you to run more tests. And as you well know, DNA is made up of the four nucleotide bases. And so essentially it's almost like reading a book. So you can actually read along the genetic code for those 4 bases and see if there are changes that are big enough that would cause someone to, their gene not work the way that we would want it to, and that's what ultimately results in disease.
Can you share a case that was particularly memorable to you?
Yeah. So let's see, there's a lot, but I had a family who had a little girl whose liver was larger than it should have been. Her tummy was actually quite big, and it was all because her liver was bigger than it should have been. And she also had some recurrent nosebleeds, and it always seemed like when she would get a cut, just took her a really long time to clot. And she ended up having a condition called Gaucher disease. Which affects all those things were part of Gaucher. And we got things, figured out for her, got her the care that she needed, but she actually had a little sister. And because it was a genetic condition, the little sister was at risk to have it too. But because she was younger, she hadn't developed symptoms yet. And so I actually helped the family get the little sister tested. And unfortunately, the little sister also had Gaucher. And that was a particularly hard phone call to make and tell the family that both of their little girls had this condition. The one bright spot was that the family actually got pregnant a 3rd time. And when they had their little boy, I was able to work with, he was born, I think, in like Hickory. And so I was actually able to work with the neonatologist at that medical center. I think it was at Fry, but was able to work with them and get the little boy testing while he was still in the hospital after birth. And he did not have Gaucher. So we were able to tell the family before they took him home that they didn't have to worry about that. Yeah. So that, I think that was a nice case, because I was able to kind of see the family through the tough times, but also was glad to be able to kind of give them a win, and make sure that they didn't have to worry about getting him all the way down to Duke to get that testing, and figuring out a way to kind of walk through the neonatologist there so that it was easier on the family.
Yeah. Well, that's great, because then, I mean, if I were a parent and 2 of my daughters had it, then I'm obviously going to be worried about, my newest born having it too. So that's great. Did you work with pharmaceutical companies that were trying to find treatments for the diseases that you had studied?
Yep. So, genetic conditions as a whole don't have a lot of treatments. But the type that I worked with, the biochemical ones, most of those are due to enzyme deficiencies. And so there are actually companies that can manufacture essentially through genetic engineering, not the exact enzyme, but a pretty close replica that then a patient can receive either through an IV infusion or an injection, depending on the medication, that they then can use in their body, since their body doesn't make the enzyme. And so I was lucky in that not most, but a lot of the conditions that I saw patients with, there were some treatment options. And obviously that gets done through pharmaceutical companies. So I regularly would meet with them to get updates, find out, how were the clinical trials going? What kind of timeline were they thinking? Or perhaps I had a patient already on an approved medication, but say maybe they had a reaction. So I might go to them and say, what data do you guys have on this type of reaction? And are there other physicians who've experienced that I might be able to talk to make sure that we're managing this the right way?
Yeah. And what piece of advice would you give someone considering a career in as a genetic counselor?
I would tell people that you have to be okay with people making decisions that are different than what you would make if you were in the same situation. So it can be really hard if you have strong opinions about, you know, if you're someone who always believes that more information is better and you
Mhm.
always think that testing's the right way to go, and you encounter a family who very much feels like they don't want to know something, that can be really hard. So I tell people you need to be okay with people making decisions that are different than your own, because your job really is more to provide them with the information, help them work through it so that they can make the best decision for them, which is not always congruent with what you might
Yeah.
decide.
Yeah. Well, I thank you again for your time, and it's really fun seeing you again. And I hope we can meet up in Asheville soon with when COVID's over. Crossing my fingers over again soon.
Yeah, that'd be
So
great.
yeah, we have a bet going on in school right now because I switched to a private school so I could do in school because I could not learn online. And my math
Gotcha.
teacher's like, I'm betting that we're gonna be out by November, and I was like, oh yeah, definitely, because traveling for the holidays it's gonna be a wreck. So
Yeah, it's gonna be rough for sure. But yeah, no, I have. Now remind me, you guys were building a house, right? Or has that
yeah.
started? Or
hmm
okay.
Yeah, I think they got the permit either yesterday or today.
Oh
So
wow.
yeah, but the only downside is it's gonna be complete right around the time that I'm gonna be moving to college. So I have to move to the new house into college. So I'm like, mom's like, don't worry about it. We'll get it all figured out. I'm like, I know, but I like to plan and have everything organized. And so I come home and it's all relaxing. And so that's great. Thank you. Um, yeah, I hope we can catch up. And after this, I have to send you a link to fill out for our Zoom call saying like what we did. And it's kind of like an evaluation on me. So,
Okay.
yes, thank you again. Have a good one.
Absolutely. You too, hon. If you need anything, just let me know.
Okay, thank you.
All right. Bye.
Bye.